changing when there's so much uncertainty. How about levels of restrictions when they change? About people's jobs and also about things like whether we'll be able to celebrate Christmas. I know I've mentioned Christmas. Dr. Sophie Homer is a lecturer in psychology at the University of Plymouth. Morning to you, Sophie.
Good morning.
Morning. Lots of people will be feeling low, feeling anxious, won't they, about the situation we're in. Is that pretty normal, would you say?
Oh, absolutely. In general, we are creatures of habit, really. We do like routine and certainty, or at least knowing what's going to happen and things going to plan. And we're also social creatures as well, and we do get a lot out of, interacting with others, positive interactions and feeling connected to others socially. And all of those things are being affected, really, by the pandemic and the restrictions. So, yeah, a lot of uncertainty, a lot of anxiety, and people possibly feeling a little bit flat as well, a little bit low.
Yeah, and when we get into a negative mindset, it really is difficult for a lot of people to get out of that, and that has an effect on how we feel generally, doesn't it?
Absolutely. It's sometimes called in psychology a negative cycle or a negative spiral, because once it starts, it kind of spirals from there, and then it can be harder and harder to get out of it. So what I would say is that it's really important to try and catch yourself as early as possible if you are sort of feeling a little bit anxious, or if that that inner voice that we all have starts to kind of sound a little bit negative. Trying to catch that as early as possible and thinking, can I reframe this in a more positive way?
It would be unfair to ask you to give a definitive answer in just a couple of moments, Sophie. But, when we have that fear of uncertainty, how do you go about tackling that for somebody?
It's a very normal thing. It's sometimes called intolerance of uncertainty, this kind of negative reaction to uncertainty. But actually, we can probably all relate to it. It's kind of this fear of the unknown. And some studies have shown that not knowing can actually feel worse than knowing for sure that something bad is definitely going to happen. So it really is the not knowing that's key. And I would say it's important to kind of feel prepared and informed, but on the other hand, not over-informed. So really important not to be kind of, constantly seeking information. That can actually add to feeling overwhelmed and add to the uncertainty because you're getting lots of conflicting information. So I would say keep yourself informed, but stick to one or two key sources that you really, really trust. And have a plan in place as far as possible. And if there is uncertainty, can you have a plan B or a fallback plan just to give you that little bit of reassurance?
That's interesting what you say, Sophie. Isn't it incredible? There are now thousands and thousands of medical experts on Facebook, aren't there? Have you noticed that?
Yes.
Some people, I'm sure you've seen this, some people have been joking about it. Oh, Christmas will be cancelled this year. But on a serious point, is it important for us to plan things that we can look forward to so we can have that target? We can think, oh, it's relative's birthday coming up soon, or, just something, a favourite TV programme's coming on next week. Is it important to have those little positives in our mind when we look ahead?
Absolutely. Psychologically, having things to look forward to is just so important. It's so important, in fact, that it is a technique used in psychotherapy. And it's important because it gives us that sense of kind of hope for the future, and hope produces feel-good endorphins in our brains that give us kind of a sense of positivity and well-being.
Yeah.
And it makes us feel a bit more calm as well, and makes it easier for us to relax. And so some research has actually shown that looking forward to an event or the anticipation can actually be more rewarding and more enjoyable than the event itself. So if we have nice things in the diary, we get all that added benefit of being able to look forward to it, get excited about it, make plans, which keeps us in a positive mood.
I want to finish on a positive with you, Sophie. Is that all right?
Yes, please.
Good, because we're asking what makes you feel good, a little perker-upper. Kevin, our weatherman, His cup of tea in the morning does it. Louise reading our news today. She's got her favourite fluffy jumper on. Makes her feel nice in the morning. What about you, Sophie? What's a little thing that makes you feel happy?
Do you know what? I actually quite like this time of year. I quite like the sort of, it's colder, it's darker. I really like that feeling of coziness inside. So I love kind of having the fire on, having a warm drink, having a blanket, reading a book. I'm happy.
Perfect. Good answer. Great to talk to you, and thanks for an insight into what you do. Fascinating, Sophie. Thank you.
Thank you so much for having me.
You're very welcome. Dr. Sophie Homer, lecturer in psychology at the University of Plymouth, with us on BBC Radio Devon.